So I want to make sure that I get those all lined up.
Got it. Yeah, I will go ahead and send out a club-wide email for the dates for the next few meetings up till the end of the year.
That'd be great.
And I'll put a note in there that those evening second week events are going to be closer to the date when we know the actual times. But I have encouraged Stephen and that whole group to get on those sooner than later, but event booking and all that. So.
Oh, one cheese, just cheese.
That is what happened.
Okay.
All right, I'm gonna.
All right, okay.
You're not on mute.
It was I mean, before they said, no, you cannot do it.
What happened now?
Everybody's so quiet today.
It's that rain.
Maybe that's it.
We're all muted. We're not supposed.
Heather, glad you made it back safely. Looks like you had a great time.
It was a wild ride, literally. We covered. We went through, I think, 30 states and one Canadian province and the District of Columbia in 46 days. And then got back home, and it was quite an adventure, but it was a lot of fun.
Wonderful, Heather. I'm going to put everyone on mute because we're about to start the meeting.
Welcome to the Rotary Club of Seattle for our first meeting of autumn. I hope you're all staying dry. At the beginning of the week, I checked the statistics and found out that Seattle was still 6 inches down from our annual average rainfall to date. So I think all the meteorologists, collaborated and said, let's try to make up for this shortfall all in 1 week. So we didn't quite make up for the shortfall, but our reservoirs are a little happier now. And so are our native Seattleites who have, we're used to the rain. So I'm Nancy Cahill, the current president of Seattle Rotary, and I'm glad you can join us today. We're also grateful today to have Dan Mead-Smith serve as our meeting reporter. Today, we'll start our meeting with an inspiration from Bill Center.
Thanks, Nancy. It's great to see everybody. Wish we could meet face to face. That'll happen soon enough. Few things inspire me more than people with the vision to tackle truly audacious goals, like winning the World Series. Are you listening, guys? A great game last night, but there's lots more work to do, I believe, and I've got my tickets. Today's speaker, Dr. Doris Macharia, is not afraid to tackle an audacious goal. I'm really looking forward to hearing what she has to say. That got me thinking, what does it take to embark on a goal like significantly reducing the worldwide rate of preventable blindness? It requires awareness to recognize there's a big challenge out there that we should address. It takes extraordinary vision and imagination to see potential paths to solution. It requires leadership and charisma to inspire others to share the vision and join in the daunting effort. But most of all, it requires unassailable courage to convert the naysayers, surmount the setbacks, and sacrifice your own comforts and priorities for the greater good. In the presence of courage like that, we are properly humbled and inspired. We thank God for amazing inspirational leaders like Doris Macharia, and we thank her for joining us today. Amen.
Thank you so much, Bill. You are one of the inspiring people in our lives, and our club is so grateful for your presence. So today, Karma McKay is serving as our Zoom host and will welcome our guests. Thank you, Karma.
You're welcome. And, you know, there's so many inspiring people as I see these faces all around here. But for those, many of you will not know the people that I will introduce right now. And of course, Dr. Doris Macharia is our speaker today, who will be introduced in much more detail. Elise Carlson, who is the Global Director of Foundations and Government Relations at Orbis, and Kimberly Urish, Senior Manager of Major Gifts at Orbis, Brittany Hillier, Grants Associate at Orbis, John Anger is from West Seattle Rotary and a past district governor. Emma Richardson is with Healthy Athletes Manager of Special Olympic. She is the Healthy Athletes Manager at the Special Olympics and guest of David Wu. JJ Gardner, also from West Seattle Rotary, is a past district governor. And Dr. Girish is from India. He had hoped to attend last week and wasn't able to make it, but he's here today. And he's the Rotary Club of Mumbai in Cavadilli West. And my apologies if I mispronounced many of those names. If you're here as a guest or a visiting Rotarian, I did not call your name, please put your name in the chat box so we can all at least give you a little wave. Back to you, Nancy.
Thank you so much, Karma, for that. And our Rotarian guests from India do win the award, coming the furthest, whether or not it's through cyberspace or whether they are actually on our soil. Either way, you're our winner today. So our member, Heather Fitzpatrick, who is the Executive Director of Wellsprings Family Services, will give us an update from Wellspring.
Thank you, Nancy. And I'm hoping that everybody can see my screen.
Good job.
All right. Progress here. All right. So good afternoon, fellow Rotarians. Thank you for inviting me to give an update on Wellspring Family Services today. Well, there's a lot going on in the house that Rotary built, the Rotary Support Center for Families. I'm going to focus on Wellspring's efforts to prevent homelessness among families, which is, to Bill's comment, our big audacious goal. For over 130 years, Wellspring has been focused on helping families navigate homelessness, and it isn't easy. And addressing the issues, it isn't easy, and addressing the issues once a family has become homeless is expensive. To illustrate, it costs about $70 a night to rent a 2-bedroom home in King County. But once a person loses stable housing, it costs about $158 a night to get them the services they need to get back into housing. And that process of getting back into housing takes about 270 days. So that's 9 months that a family with children experiencing homelessness is likely to be in that predicament. We can save more than half our costs if we focus on prevention. And that's just the immediate cost. We know that what we know about homelessness for families is that it repeats generation after generation, largely because there's no generational wealth accumulation after a family loses everything when they become homeless. That means that parents can't help their children when they run into similar financial issues when they become adults. And the trauma also has a cost. Children who've experienced homelessness are more likely to have mental health challenges, trouble relating to other people, or behavioral health problems at school, or behavioral problems in school. An ounce of prevention really is worth a pound of cure. So how do you prevent family homelessness? To do that, you actually need to understand what causes it. Family homelessness is not generally the outcome of behavioral health issues like addiction. Most families experiencing homelessness are employed and living paycheck to paycheck. They just don't earn enough money to consistently pay their rent. And they aren't the only ones in that situation. In fact, across the United States, more than 60% of the US labor force currently lives paycheck to paycheck. It's a bigger issue in urban environments like Seattle, where the cost of living is higher, and it's a big issue for families. 40% of the US labor force is in a family setting with children under 18, and 66.1% of parents live paycheck to paycheck. Of those, more than a third are struggling to pay their bills. So if you add the adults who are unemployed with children in their household, which is about 8.8% of all families at any given point in time, and you add those to the people, the group that is employed, living paycheck to paycheck, and at risk of homelessness because they aren't paying their bills, it's about 31.5% that is facing eviction at any given time in the United States. 31.5% of all families. And the light blue slice here, those folks are living paycheck to paycheck without reserves, and they're just one paycheck away from being in the same boat. So the bad news is that 1 in 6 of those in the yellow and orange slices are already experiencing homelessness, about 5% of all families. The good news is that we have a solution for the other 5 of those 6. Unfortunately, since services for people experiencing homelessness are generally delivered through government contracts, and the government is more concerned about addressing the needs of people who are already unhoused than turning off the faucet at the source, most government benefits are unavailable to people who are employed. Fortunately, Wellspring has identified another means of delivering prevention to families. Financial instability in the workplace costs businesses lots of money. About $600 billion, $500 billion a year in money. It's a very expensive issue. And that's because people who are on the brink of homelessness, who are struggling to pay their bills, who are scared about their financial situation, are less productive at work. They're more likely to be in accidents. They're more likely to have to leave their jobs in order to access benefits or find new housing and find a job closer to their housing. They're more likely to be depressed and anxious, which just makes them less productive. There is a group of people that would like to see all wages be raised. You know, we can combat this by just raising the minimum wage for everybody. If everybody earns $75,000 a year, life would be good. But that actually doesn't work out from a kind of a labor economics perspective. When wages go up for employees, labor costs go up, labor costs rise, so do prices. When prices rise, that includes rent and other basic necessities. If we raised everybody's wages, the cost of living would go up, and we are in the same boat. And unfortunately, paying just employees who need more money also doesn't work because of wage equity laws. But we do have a solution. It helps employers address financial anxiety, it prevents homelessness, it reduces taxpayer burden, and it delivers a solid return to employers. It's called the Wellspring Employee Stability Program. Structured as an employee benefit, the Employee Stability Program provides employees with anonymous access to case management services that are like those offered through government assistance programs. Wellspring's case management team members are experienced at preventing and ending homelessness, and they are specially trained to deliver financial advice to employees who do not have the means to address a financial crisis. But we need your help. We need to get the word out about our newest program, the Employee Stability Program. We would love to do that through speaking engagements and, of course, direct connections. We also need help with our existing programs. We are short volunteers right now, especially unusually short volunteers, because we don't have interns in our family store. And we really need help, especially during the week, packing supplies for families in our free family store that provides supplies to families who are experiencing homelessness or low income and at risk of homelessness. And we can always use everybody's help with the Community Service Committee when we do our Rotary Day, which is the next one is on October 21st. So that's my brief update, but I did want to say thank you to all the Rotarians who cheered as I visited all 30 stadiums, and we did make it. We went through and got to all 30 stadiums. We had to double back on Cleveland because it got postponed with rain once, and then we got rained out the second time too, but we got 2 innings, so we considered that our full game. And so we did visit the stadium and saw the players play. So 30 stadiums and in 50 days, and we raised $32,000 for the Employee Stability Program at Wellspring. And I could not be more grateful to all the Rotarians who supported that kind of little campaign of ours that my family undertook. And we had a lot of opportunity to talk to people across the United States about employee stability and the link to family homelessness. And so thank you all for that support.
Thank you so much, Heather. That was such a powerful example you gave with your depictions on really what the impact of making preventative care at such a reduced cost. That was really powerful. I'm hopeful what we can do is maybe put those slides up on our website to just provide a chance for people to look at it a little more fully. And then to realize that essentially 2/3 of the population has some degree of instability or risk of being just one missed paycheck away from stability. So I think that's really important for all of us to know, and know the impact on our people in our community and in our country. Thank you so much for that information. And now Dorothy Bullitt will be introducing our keynote speaker. Thank you, Dorothy, for being here.
Thank you, Nancy. Orbis International is an NGO dedicated to saving sight worldwide. Its programs focus on the prevention of blindness and the treatment of blinding eye diseases through hands-on training, public health education, advocacy, and local partnerships. Dr. Doris Macharia is its Senior Vice President of Global Programs. She is responsible for overseeing over 60 projects in Africa, Asia, Latin America, and the Caribbean, and leads a global team that designs, implements, and manages eye health programs. Dr. Macharia has over 25 years of experience in global health and development. Her experience includes, among other things, managing regional programs for malaria, tuberculosis, HIV/AIDS, COVID-19, and family planning. Prior to joining Orbis, Dr. Macharia held senior positions at UNICEF and the U.S. Center for Disease Control and Prevention. She holds a Bachelor of Medicine, a Bachelor of Surgery, and a Master's in Internal Medicine degrees from the University of Nairobi, a Master's in Epidemiology from the London School of Hygiene and Tropical Medicine, and a postgraduate diploma in Health Economics from the University of Cape Town. Dr. Macharia grew up in Kenya and now lives in South Africa. Please join me in welcoming Dr. Doris Macharia, who will speak to us today or tonight from where she is, from Pretoria, South Africa. Thank you so much for joining us today, Dr. Doris.
Thank you. Thank you so much, Dorothy, and thanks everyone for having me. It's indeed a pleasure, I must say, to be here. And even as I start my sort of presentation today, I wanted to just start off by sharing with you all this this particular picture here, which starts off my presentation. It is taken in Ethiopia, the month of May this year, and it was the 100th millionth dose of Zithromax to treat trachoma infection in Ethiopia. And in this particular picture, there is the State Minister of Health, as well as Derek Hodgkin, who is our CEO. So I really, I'm really honored to be here, and I do hope that you know, as I walk you through some of the work that we are doing, you know, happy to discuss and take, of course, questions towards the end. So as Dorothy introduced me, perhaps just to let you all know, my own public health career began when I was in Kenya. I was actually set out to be an internist, and I thought I was going to be treating people and having my own private practice. But that has obviously that changed, and I did start my own career in an informal settlement in Nairobi, Kenya. Trying to make sure that we can work with the Ministry of Health to ensure that there is HIV treatment that is available not only to those who could afford it, but also to the marginalized communities and those who could not access care. I'm really delighted to have joined Orbis more than 2 years ago, and I continue to really be amazed that that we have this great opportunity to be able to make a difference globally in terms of preventing avoidable blindness. So why does global eye health matters? One of the things is that, we have over 1 billion people around the world who are living with vision loss or are blind. And the amazing thing is that 90% of this is avoidable, and therefore something that we can do about. Interesting enough is when you think about health equity, what comes to our mind is thinking about that over 100 million of people who are living with vision loss are women. And this again, gives us some time to sort of pause and think, why is this the case? And I will talk to this a little bit in the slides that follow, but primarily because of health-seeking behavior, of course, the lack of economic means, amongst others. But again, this is something that we can do something about and ensure that, one, that fewer people are obviously living with avoidable blindness or vision loss, and more so be able to address the fact that there's this health inequity where women are having more vision loss than men. Thinking about the causes of vision loss and vision impairment globally, unoperated cataracts and as well as uncorrected refractive error. And refractive error in this case means, far or near-sightedness, as well as astigmatism and also presbyopia. These are all conditions of the eye that cause vision loss, either because of age or because of other reasons. But these are easily corrected. I think more importantly, even even growing up in Kenya and thinking about the work that Orbis International is doing around the world, 90% of people who are living in low and middle income countries in Africa, in Asia, and Latin America have little access to quality eye care. Again, something that we can be able to do something about in the spaces that we are. I think lastly here, just to also mention that, women represent almost, just about a third of all ophthalmologists, and even less than a half of those who are training to be ophthalmologists are women, and few of these are in low and middle income countries. In this graph that I show here, that is illustrated here on the right, it illustrates, when we are able to address refractive error through, glasses such as the ones I'm wearing and many of you are wearing. If you look at high-income countries and low-income countries, something as simple as wearing of glasses and being able to be diagnosed and have that corrected, we can see that there is a disparity in terms of high-income countries and low-income countries. So a little bit about Orbis. We started our work more than 40 years ago with the Flying Eye Hospital, and we've been able to innovate, and we've been fortunate enough to do that through fellowship programs in the late 90s, as well as investing in long-term country offices such as those in Africa, in Asia, Latin America, and the Caribbean, just as Dorothy introduced. In 2003, we innovated and were able to launch our telemedicine platform, which is CyberSight. And further to that, just before the COVID pandemic, we were able then to establish training courses that are offered in CyberSight so that they're offered across the world. In fact, Cybersight is, is able to be accessed in almost all countries. I think with the exception of, I think 2 countries, one is North Korea and the other one in Africa. So it tells you that, that having this digital platform has enabled us to be able to reach more people, not only ophthalmologists, students, residents, and other allied health professionals and allied ophthalmic staff as well. In 2017, we deployed a remote resident wet lab mentorship, again through Cybersight, and then that followed on with simulation training. And more recently, we were able to launch our 5-year global strategic plan, which really guides the work that we're doing, obviously, for the next 5 years. And we're really excited about that. So what I wanted us to just spend a little bit of time today is to just wanted to share with you all some of our community-based health, eye health interventions. And why this is important is because, bearing in mind a lot of the preventable and avoidable blindness, 90% of them, can be addressed by high impact and cost-efficient interventions, such as those that I will discuss. One is Green Vision Centers. I'll talk about the women-led Green Vision Centers. And then lastly, I'll just discuss about what Orbis is doing in terms of integrating eye care in humanitarian settings. So what are Green Vision Centers? These are an innovative and very sustainable social enterprise model that we have embraced and managed to replicate in a number of countries, such as India, Bangladesh, and many others, and even in Peru as well. And what we do here is to work with local partners to provide comprehensive eye care and services. That also includes teleconsultation, referral, and follow-up, as well as ensuring that we can create safe spaces where women and children can access care. And like I said, uncorrected refractive error, farsightedness, nearsightedness, as an example, are easy to correct. And that can be done in these Green Vision Centers, as well as providing medicines such as those that, like for conjunctivitis, pink eye, for instance, and others. And this is what we are doing through this very interesting and very exciting innovation. Why Green Vision Centers? Because they're energy efficient. Green Vision Centers, means that we are able to address issues of the electricity interruptions that many of our countries face, and just having the solar panels means that those in the community can come to the Green Vision Centers, can have their eyes checked, can get referrals, and then can go home in good time, rather than having to wait for queues or maybe being told to return back home. So the uninterrupted power supply also enables us to address the issues of energy in a more efficient way, and of course, minimizing carbon emission. To the right here, as you see here, is a scooter. This is called an electric scooter, which we also call e-bikes. And these are used by the outreach teams at the vision centers to do school and door-to-door screening, as well as creating community awareness about being able to come to the Green Vision Center to come and get your eyes checked, so that you don't continue to have your vision loss, because most of it, as I mentioned, is avoidable. I want to introduce you to this young lady called Tamana. She's a young female student in India, and she was having headaches and couldn't see, and was having a really hard time with her studies. And her mother, who is standing there behind her, brought her to the Vision Center. And now she's able to, she had her vision corrected. She wears her glasses, her eyes don't water anymore, and her headaches have stopped, and she's really excited and aspires to join the police force when she grows up. And as you can see her here, trying on a pair of spectacles, and she's able to choose the pair of spectacles that she likes, and she's able to be compliant in terms of having these spectacles. So this again is really exciting, because it's not only Tamana, it's young people like Tamana, and also older people like her mom and her family members and other community members who are able to access these services at these Green Vision Centers that are close to where they live. So thinking about, as Orbis, we looked at the Green Vision Centers and thought about how we can adapt them even further to be able to address the health inequity, especially faced by women. A couple of things here is that we know that women have less access to either whether it's secondary or tertiary health facilities, especially in low and middle income countries, perhaps due to social restrictions or even their mobility coming from their homes to the health facility. We also know that at times even having the fact that there are lack of female eye health providers, whether they be optometrists or other mid-level ophthalmic staff or even ophthalmologists, it means it also becomes a barrier for women and their families and their children to access and to be able to open up in terms of the conditions that they're having and what is bothering them and be able to get attended to properly. There's also economic reliance on male members of the family, as we know in many of our families across the world. And as well as, women's health sometimes is given less importance in the family. So as we looked at these sort of issues and these sort of barriers, we started asking ourselves as Orbis with our partners, what do we need to do to address this? And I think one of the first steps we did was to explore how we can establish a gender inclusive eye care system, knowing very well that, the women will come, obviously the men will come, and their children and their family members, bearing in mind, like I said, the issues of health inequity. So that was the first step in terms of first understanding what is the problem, and then figuring out how we could address this issue using and leveraging on the Green Vision Centers to ensure that we are reaching all members of the community as much as possible. So the Green Vision Centers are, women are employed there to see the patients who come through. They also refer. They are also able to access and contact other healthcare professionals in the higher level centers, whether it's a secondary hospital or a tertiary hospital, to ensure that the client that they're seeing in front of them is able to get all the services and all the help they need. So Green Vision Centers empower women, and therefore then these women are able to be role models, especially for young women and girls, and they can aspire to also work in that particular Green Vision Center, or even be able to aspire to do even much more. And that is really incredible. The other thing is that women vision technicians contribute to a high acceptance of eye care services. Women in communities such as those in Bangladesh and in India, as an example, it's hard for them to leave their homes unaccompanied, and also sometimes to see a male health provider. And having a female health provider does help them open up and be able to access and engage with that service much better. And of course, there's an increased opportunities for women who are working there, and therefore raising the economic status of many women living in these communities. Again, just sharing with you, really, really fantastic story here of Anwara, who is a 50-year-old woman. She was having, living with hypertension and diabetes. And, she was not being able to see, especially on her left eye. And she had, she had looked for various regimens of medication and doctors, and it was, she was not getting the help that she needed. So she visited one of our vision centers in Bangladesh. And immediately she was diagnosed to have a cataract, and was explained for that this is it is a fairly simple procedure for her if she goes to the eye hospital that was close by and gets the cataract removed. And you can see from what she's saying here is that, she was extremely thrilled that, her eyes were tested by a woman, and also that she was able to express herself, which I think is really critical. And the fact that she was able to go and get the cataract removed and have the surgery done. And obviously now she's able to see, and she's able to, to attend to her various responsibilities in her home and take care of her family. And this is really, really a profound story. I think lastly is just to share with you all in terms of the work amongst the refugee community. As many of you may know, there was a very large influx of the Rohingya refugees from Myanmar to Bangladesh, to southeastern aspects of Bangladesh from 2017. And currently there are over 900,000 Rohingya refugees living in about 33 camps in Bangladesh, and majority of these are female, and obviously a lot of these are children. And we have an office as Orbis in Bangladesh, and one of the things that we realized very quickly with our partners in Bangladesh was there was inadequate eye care services in the camps, and the population of refugees was growing literally on a daily basis. And we had to do something. And, with generous contributions of donors, as well as working with partners and an amazing team in Orbis, we were able to establish eye care services, including referrals for many of these Rohingya refugees in the camps. So we established the Balukali Vision Center, as you can see here. It's in Camp 11 that offers eye screening and various eye services, and also referral to a hospital in Cox's Bazar. Cox's Bazar is in the southeastern part of Bangladesh, where the Rohingya camp is. And it's about maybe 30 miles from the actual refugee camp, and the refugees get escorted there, have their cataracts, either surgery done, and other procedures so that they are able to have their vision restored. Especially for children, those are usually referred to a tertiary hospital in Chittagong, which is approximately about 100 miles. It takes more than 3.5 hours by road from Cox's Bazar to Chittagong. So that sort of tells you, the importance of ensuring that, we can have a community eye care sort of service that is in the refugee camp to enable us to provide services as quickly as possible and make sure that, only those that need to be referred then get referred. And this has really been, I think, a service that has had a lot of access from the Rohingya refugees, and I think has been very welcome in terms of the work that is being done there. Lastly, I just wanted to just end here with Dr. Islam. I actually met with Dr. Islam when I was in Bangladesh in July, and he's an amazing ophthalmologist, was born in Cox's Bazar and dreamed of becoming a doctor, which he did, and is back in Cox's Bazar in Cox's Bazar by Sharaf Hospital, which is a great partner of Orbis International, and has now been working there for over 5 years and is really serving the community well, and has provided services to more than 30,000 Rohingya people. And as you can see, he really reiterates here that the Rohingyas are helpless, and they are displaced families, and he wants to continue making a difference, and he feels fortunate to have been to have contributed to to the fact that their blindness has been prevented and they have had their vision restored. He's an amazing doctor, and I was really privileged to meet with him, as well as other members of the Cox's Bazar by Sharaf Hospital, and obviously other colleagues who are making a difference and working together closely with Orbis in Bangladesh. I just wanted to end that and just say thank you all. Obviously, happy to take any questions. Yes, over to you.
Sorry, it took me a second to get unmuted. Thank you so much, Dr. Macharia. There are questions for you in the chat. I thought that was really incredible, and super happy that you have joined us to share about the work that you're doing. The first question that we have comes from Dorothy. She would like to know what led you to work in the field of eye health.
That's a great question. Actually, one of the things I realized was that having worked in the areas of maternal and child health and HIV and TB, after I'd read a little bit about Orbis, and I was just really amazed about the places that Orbis was working and the difference that we are making. I mean, when you think about cataract surgery, or even just wearing a pair of specs, it's such a high impact intervention, most of the time low cost, And that really, I think, pulled me. Over and above that, working in places like Bangladesh, India, Ethiopia, Zambia, Peru, I mean, I also felt that that's something that could definitely contribute to in terms of the mission of preventing avoidable blindness. And of course, deploying modern technology to be able to do this great work, I think in itself was just, I think for me, mind-blowing. And I really felt I needed to be part of that and be part of that mission and see how, I could also be in a place of making a difference along with amazing colleagues such as those who are here and others as well.
Wonderful. Thank you. I have a question. There's more questions, but I would like to interject one of mine here. Is any of the work that you're doing in these areas impacting the rate of mortality in a positive direction?
Yes, it is. One of the things is, Mary, is realizing that when going blind, affects so many aspects, or even just vision impairment affects so many aspects of one's life. Sometimes, we think of various morbidities and mortality due to other illnesses, but sometimes vision loss is so underestimated. But think of a woman, just like the one I just shared, Anwara, for instance. She can't see. Soon she will be blind and therefore can't take care of herself. And eventually, actually, it's a slow death in itself. So yes, with respect to, obviously there's the indirect aspects of preventing, obviously, mortality, but certainly morbidities with regards to vision loss, right? If you look at young babies with retinoblastoma, cancers of the eye, certainly that is a fantastic way of making sure that the children can not only see, but they can also have, a good quality of life. So it is both direct and indirect, and just the value of just being able to see cannot be underestimated in terms of the impact it makes on one's life as a whole.
Wonderful. Thank you so much for sharing. Mary Goldie has a question, and I'm sure she asked these questions because Rotary has such a large reach across the entire globe. Have you come across regions or countries where you'd like to have a presence but have had troubles doing that because of unfavorable government or social environments? And how do you find ways to work in those difficult or dangerous regions?
Yeah, a very good question, Mary. I mean, just on behalf of Orbis, we would like to be in many places doing all this great work, but obviously it's not always possible. The example I gave in terms of the Rohingya, working in the Rohingya camps, that was really tough. First of all, the Bangladesh, government initially, there was the resistance of, what do we do here? They're soon going to go back home, right? And of course, that did not happen. And just being able to intervene with partners as well as with government, working, in that sort of fashion, I think has helped us to be in the countries where we are working. Are there countries where it's been unfavorable? I think not as yet, because again, we think of how we begin our work. We have a flying eye hospital. We deploy training in terms of hospital-based training. And then of course, we've got this long-term presence in countries. We realize that at times it might not really be easy to work, but again, thinking about, we are not there alone. Ensuring that the work we do has to be guided by the ministries of health and local government, and as well as partners, enables us to make sure that our own blind spots, so to speak, sorry about the pun, but our blind spots are sort of addressed so that we are able then to work in various areas, within the countries where we are. But, we look forward to seeing how we can expand our work, not only in the countries where we are working, but also in other countries, but ensuring that at all times, we are addressing the needs of each country.
That's great. Thank you. And later on, I urge you to take a scroll through the chat because you do have some connections,
yes.
People reaching out from India. So we won't go over those because they're not connections, but I think that you definitely need to have some contact information shared there, and we can have may your karma get to that. But to your point of kind of meeting where people are at in the countries where you're providing these services, there's a question from Bob Alexander. In countries where women cannot be treated by men, is the opposite true? Can men be treated by women? So I'd love for you to answer that question, but I would love for you to take a second to talk about some of the intricacies in the areas that you're working at and how you have to meet the needs of the people that are there because of their religious beliefs or cultural representation or what have you. I think that would be really interesting and we would benefit from hearing some of that.
Yeah. Yes, I think one of the ways, I think what has really been critical in terms of the way we engage at country level is to ensure that if I, as Doris, for instance, being Kenyan, being in South Africa, it is almost very difficult to know what's happening in a corner in India, in Uttar Pradesh, right? I mean, I can't make those assumptions. I have to be culturally appropriate, but having a local team, local team in India, local team in Vietnam, local team in Ethiopia, enables us to ensure that, we are addressing the needs of the country, but in culturally appropriate ways. For instance, in some countries, yes, a woman might not necessarily see a man. However, a female doctor may, see a male doctor, but sometimes not the other way around, like I was sharing, because again, in some communities and in some countries, there's the fact that women are sheltered and they have to be escorted by a male companion or a male relative, and that makes it very hard. But having local teams, I think, is a very good way of addressing some of the issues, because then we don't get blindsided in terms of the cultural issues that might be prevailing, but as well as ensuring that we use evidence-based like analytical methods, such as looking at, what are the needs of the community? How do we address these issues that we can see women are not coming? The community, making sure the community voices are part of the way we come up with interventions and solutions. I think make sure that whatever we put up, whether it's a Green Vision Center, whether it is a camp that we are running, that it's something that has come from them rather than us as Orbis saying, this is what you need. So the needs have to come from the community members, but our local teams, our local country program teams really help to guide that process and enable us to ensure that we can select and work with partners that, that are also aligned to the mission of Orbis as well. Mm-hmm. Okay.
That's great. Thank you so much. And the repetitive thing that's going on in the chat is that there is a call to action. You have some partnerships that are about to happen in India. I can feel it. So yes. I love to see this. This is why we're all Rotarians. There's a couple of questions pointed at understanding if you work with other NGOs. I assume the answer is yes. Can you,
yes,
we have a little bit more time. Can you share some of the NGOs that you do work with? Maybe some of them we're familiar with?
We really try to make sure that even in country, we, let's say for India, let me give an example. We try as much as possible to work with partners who are in country as much as possible, because like I said, they are also very much conversant with cultural issues and local laws, etc. But for instance, in Ethiopia, we are working with a number of even international NGOs, the Carter Center, for instance, Fred Hallows, the Fred Hallows Foundation, as an example. Those are large NGOs that we are working together to resolve and solve the issue of trachoma among, the Ethiopian community. So those could be examples, but there are also other partners that we are working with in country as well, and also collaborating with also a number of organizations such as PATH, such as Engender, to look for ways that we can work together and integrate iHealth and respond to the integration of iHealth into this other program areas such as maternal and child health, etc.
Fantastic. Thank you so much. I have really appreciated this. I will give this back to President Nancy.
Good.
Thank you. Thank you so much, Dr. Macharia. In appreciation for your time with us, we've made a donation to an organization near us here that we support. It's called Harvest Against Hunger, and we have donated in your name 600 portions of nutrient-dense produce in appreciation for your time.
Isn't that awesome?
Yes.
Thank you. Thank you.
We are grateful for our club sponsors, Joel Farrell and Bloodworks Northwest, which both help partially underwrite our ability to provide Zoom access to our meetings. Thank you, Joel Farrell, and thank you to the talented team at Bloodworks Northwest. Now we're pleased to have Jeff Pritchard and Jim Barnhart provide updates on some programs of interest to our members. We'll start with Jeff.
Well, thank you, President Nancy, and I appreciate the opportunity to share some exciting and certainly meaningful news for Seattle 4. About 3 weeks ago, some 600 Rotarians gathered in Lusaka, Zambia, for the Rotary All Africa Rotary Zone Institute. For those of you who aren't familiar with some of the Rotary intricacies, the Rotary world is divided up into zones, and the continent of Africa encompasses one entire zone. And the Institute is simply a conference where district governors from all over Africa come together to plan the year ahead for all their respective districts. Well, several of us from Malaria Partners International also attended that conference. And among other things, we were there for a special announcement, a historic announcement, by Rotary International President Gordon McNally. And this was something that was in the works for quite a while. And because of the significance of this announcement, the conference was also attended by the executive of the President's Malaria Initiative, by senior representatives from the Gates Foundation, from World Vision, from PATH, and also, I might say, the Honorable Vice President of Zambia. And what RI President McNally announced was that Rotary, in conjunction with the Gates Foundation and World Vision, was launching the Healthy Communities Challenge. This is a 3-year, $30 million program to combat malaria in some of the most endemic countries in Africa. And in and of itself, this is huge for Rotary. This is the largest single investment Rotary has made outside of polio. And the 4 countries that this program will be focusing on are Zambia, Mozambique, Nigeria, and the Democratic Republic of Congo. Now, one factor is those last 3 countries are incredibly high burden. Last year, almost 600,000 children globally died from malaria. 43% of those deaths were in just those 3 countries, Mozambique, Nigeria, and the DRC. So this program is going to be designed to help combat not only malaria, but also pneumonia and diarrheal diseases. Those 3 elements together are far and away the greatest killer of young children throughout all of Africa. The program structure is called Integrated Community Case Management. Now, a more user-friendly term of that is basically household-level delivery of healthcare services by volunteer community health workers. And this is proven to be incredibly effective healthcare delivery system in the developing world for 2 reasons. The first is that it's financially sustainable. The second is it's extremely flexible. So this model can adapt to emergencies like we had several years ago at the height of COVID. It can adapt to opportunities. So as malaria vaccinations become more and more effective and more practical, this is a delivery model that can deliver those vaccinations to even some of the most rural areas in Africa. There are some caveats to this program, and that is this program will be working in some of the most remote, impoverished, and in some cases, some of the most politically unstable areas throughout all of Africa. So the work will not be easy. But because of the areas selected to focus, this has the opportunity to relieve literally millions of people from the burden of malaria, and invariably will save the lives of thousands upon thousands of very young children. Now, one of the things that is not known by Rotary leadership, and which I think club members here should find gratifying, is that this is becoming a real global initiative, and it started right here in this club. It was in 2009 that Bill Gates Sr. recommended that Seattle 4 take on malaria as the second centennial project. That effort sort of morphed into Malaria Partners International, which many of you have supported. You've served as on the board, you've been ambassadors. Malaria Partners International facilitated a lot of very early malaria global grants. And I should say a lot of those were spearheaded by Jim Moore. Those were also critically supported by your own Seattle Rotary Service Foundation. And it's those early malaria global grants that made the programs of scale malaria project successful. And it's that project which has since made this major initiative, this $30 million initiative, a success. So from the Seattle 4 standpoint, every member and certainly everyone who's been involved in the malaria effort should be extremely gratified that it started right here in Seattle 4. The other thing I think you should reflect on, and when you're sitting down this year in regard to your contributions, this shows the incredible reach and impact of your gift to not only the Rotary Foundation back in Evanston, right here to your own Seattle Rotary Service Foundation. So with that, I'll turn it back over to the program. Thank you.
Thank you.
Thank you.
President Nancy, you want me to jump in at this point? Yeah. So hi, everyone. Very, very quickly, Oxbow Farm and Conservation Center on October 7th is hosting a tour and walkabout of the farm and conservation center. We're going to meet at 10 a.m. at their farm stand right outside of the Carnation, about 30 minutes east of downtown Seattle. I'm going to give a tour for a couple of hours. We're going to learn about our organic farm programming and what that's doing, both science-wise and on food access and other pieces of the work. We're going to talk about our conservation programs up and down the Snoqualmie Valley. We're going to tour our native plant nursery, where we're trying to ignite a native plant movement across the region, and then talk about our education programs with K through 12 children that actually Seattle 4 is supporting as we speak through our Environmental and Sustainability Committee. So that's from 10 to 12. Folks should bring a lunch with them because then folks who have lunch, we can have a light lunch out by the pergolas on the farm. And then folks who are interested, we'll be hosting or actually putting on a workshop on dyeing summer flowers from one of our staff members. And so if you get online, you can sign up for that program. I'm posting that right now on www.oxbow.org. So if you're interested in staying for the 1 o'clock workshop, that'd be great. And families are welcome, kids. It's a fun place. There's you can tour the hiking trails around that we have, and it'll be a great day. So let's watch the weather. You might need to bring heavy boots just in case, but either way, rain or shine, it's a fun place to visit, and we'd love to have you. Thanks.
Great. Thank you, Jim. And thank you, Jeff, for your great announcement. That's such exciting news about malaria and such great work that you're doing, Jim, at Oxbow. So look forward to introducing that to many of our members. Many of you have also heard that Rotary has a vibrant youth exchange program. Is there a young person in your life who's looking for a unique summer experience? If you do, share with them about the District 5030 short-term youth exchange program. It's for high school students age 15 to 18. And for this next summer, it's time to apply. Students will go over to their host country to stay with a family for a month, doing everything that that family would normally do, and seeing a new culture and getting to know your host sibling and the rest of their family. Then our exchange student returns back to here with their exchange student to share our culture with that youth. Very exciting. Last year we had a presentation from Emily Thane, who did a youth exchange to Spain, and it was great to hear the impact on her and her family here, as well as the impact on the student from Spain and her family. This unique exchange promotes the exchange of culture, friendships between students and families, and promotes the spirit of Rotary within high school students. We have found many of the people that have done these exchanges have gone on to do amazing things in Rotary and in other nonprofit organizations because of this experience. Applications are open through the end of October. Reach out to Tabitha Claus from our club. She is in the district committee that for youth exchange. So Tabitha can fill you in on that. Have another couple quick announcements here. Today is the great day to sign up for our district conference in Victoria. The Fairmont Empress Hotel has created a good discount for Rotarians that are wanting to go to the district conference, and their room block discount rate expires at the end of today. So today is a good day to sign up if you have not yet. We have a good number of Rotarians having signed up for that conference, and we'd love to have you join us there. Also on Tuesday, October 10th, we will have a wonderful gathering at the Renaissance Hotel. This is part of our new cadence where we have some opportunities for fellowship and learning together. And this will be, the Renaissance Hotel is at 6th and Madison in downtown Seattle. It will be from 5:30 to 7 p.m. We will have complimentary appetizers and a chance to socialize and hear what we're calling a spotlight on service. There will be some members from some of our Rotary Service Club Service Club committees sharing about some of the opportunities to work on their committee and what are the great things they're doing in our community and around our world. So an exciting time for us to get together. That's Tuesday the 10th, and we'll have more information in the newsletter on that. So in closing, as Dr. Macharia spoke, I kept thinking about how we take for granted our sight. When parts of our visual areas are damaged, causing often profound disturbances in our perception, we begin to appreciate the range and subtlety of normal human vision. So thank you so much for the great work that you are doing, Dr. Macharia, and doing to positively affect the lives of many people throughout the world. We're very grateful for the work of Orbis, and we'll be watching in the future to see everything that this organization accomplishes. So thank you for being here today, and we are adjourned.
Thank you.
Thank you, everyone. Have a good afternoon. Stay dry.